Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing you another fascinating guest involved in creating a better tomorrow for many people out there. Today, we have the honor of being joined by Dr. Mohammed Alhamali, who is the chairman of the National Innovation and Regulatory Sandbox Committee, as well as Chief Innovation Officer and Regulatory Sandbox for the SEHA Virtual Hospital and Enablement Center, which falls under the Ministry of Health of Saudi Arabia. Dr. Alhamali is also the co-founder and general manager of the Society of Artificial Intelligence in Healthcare. He has served as a strategy consultant for a health sector transformation program, as well as director of research and development at the Model of Care Vision Realization Office for Saudi Vision 2030. Dr. Alhamali did his bachelor's of medicine and surgery with a focus on dentistry, King Saud University, also did a master's of science with a focus on oral biology and oral and maxillofacial pathology here at UCLA. A lot of really important themes we're going to be getting into today. We're honored to have him with us. Dr. Mohammed Alhamali, thank you so much for taking the time to come on our show today.
Thank you so much. It's a pleasure and honor being here. And your podcast, it's a real testament to advancing healthcare. And it's a pleasure being part of this.
It's wonderful having you. I've enjoyed, several of the episodes I've done with all things that are happening in Saudi and per Vision 2030. Would love to start things off, though, as we typically do, by handing you the floor for a few minutes, just to further introduce yourself to our audience. If you could take us back a little bit to your background story, a little bit of how you got interested in dentistry and oral health, and a little bit of your early career journey, because very quickly it becomes a health tech story as well, an artificial intelligence story. But take us back a little bit to the beginnings of it all, if you will. Sure
thing. I'll try to summarize my journey. But if I want to summarize it in one word, it will be unexpected. But I think the Creator, God, paved our way and pathway. And I think our pathway was intended to have a positive impact on our patients and the healthcare ecosystem. So I'm glad I'm doing that on a broader level. But going back, I'm born in Riyadh, Saudi Arabia. And then I moved at an early age to the United States, where my parents continued their postgraduate studies at Oklahoma University. My dad had a big influence on my career. He's a professor of industrial engineering and business management, where I saw how research, tackling challenges and coming up with solutions to conquer them, have really shaped the way I look into things. So when I decided to choose a career, since all my families are, I come from a background of a family of engineers, I wanted to do something different. I want to become an outlier. So I started searching in healthcare. And when I saw dentistry, it's actually fascinating, the cross section between the science and the bioengineer and the artistry. And I fell in love. I started with that. I did my bachelor degree in maxillofacial surgery at King Saud University. And then I continued my postgraduate studies an advanced clinical training program in orthodontics at UCLA. And as well, I did my master's in science and biology. I returned back to the kingdom, and I thought I will be part of a research center and part of the academia. But then later on, I got the chance and opportunity to be part of the dental strategy, where you have a complexity, I would call it. There is a beautiful book called Complexity Theory, where you see things from a different angles, and how can you do an assessment, and how can you design the strategy for dental for the kingdom for the upcoming years. So I fell in love with designing strategies and seeing things from scratch to implementation. I started working later on the model of care and on the specialized care. I was lucky to be part of the development of the research, enablement at the model of care, and then moved to the health sector transformation program to establish it, and then moving back to the Ministry of Health at SEHA Virtual Hospital, and creating this success story in the Ministry of Health.
Excellent. Excellent. And yeah, I was as you're talking about dentistry, I took a look at some papers that you were involved in, and this was pretty complex stuff. I enjoyed midfacial changes in the coronal plane induced by microimplant supported skeletal expanders studied with cone beam computed tomography images. That's pretty advanced dentistry. And it was just. I enjoy looking at our guest sort of research journey as well. So just want to put that in perspective for our audience that from the very beginning, you were involved in some pretty advanced R&D from that perspective. And then things go in a couple other very interesting directions with your career. And as mentioned, we see innovation, digital health, artificial intelligence, and along the way, in the middle of all this, you found in Saudi the Society of Artificial Intelligence in Healthcare. And this is a nonprofit association you created. It was connected with not just the Saudi Ministry of Human Resources and Social Development, but also King Abdulaziz City for Science and Technology. Say a few words about this. What was the impetus behind you setting up an actual society for AI at the time? And how you sort of went about this in bringing together these different organizations in the process.
As you know, that one of the things and one of the gap actually is educating and having the resources to educate about technology, especially AI for healthcare professionals. There is a big gap, and I'm part of the advisory for the GCCE workforce. And how can we attract and retain and develop their capacity? So we started in trying to establish, because AI, as we know, is considered to be a medical device in healthcare, and AI should be used as a tool. So a lot of healthcare professionals are having challenges in utilizing this tool to their advantage, and for the advantage for the patient to have a better outcome, to reduce the cost, and to enhance the optimization. So we created this society in order, first of all, to foster collaboration among people in the field. A lot of research are happening. Multidisciplinary teams are working together from the tech and from the healthcare domains. And also, it's a knowledge hub where we share and exchange insights with healthcare professionals and also with students in the healthcare as well.
Excellent. Excellent. And continuing along that, you mentioned that obviously this is a developing area that clinicians and practitioners need to learn more about. You also were actively involved in sort of patient-facing initiatives, and I think one of the ones that that is quite important in recent years was what, and I'm going to pronounce this incorrectly, Kulna Sanad, a really interesting digital initiative that you created during the pandemic that won major awards from the International Telecommunications Union, the United Nations. Ultimately, here we go again, connecting communications, IT, and health. Talk a little bit about what was involved here. I think this is a really important part of your story as well.
I think a big success factor was a collaboration. I always say that think big, start small, and move fast. And I add to that great book, Collaborate. A couple of healthcare professionals and also computer scientists came together, and we saw the issues that, unfortunately, the traditional healthcare system is actually are established around the healthcare professionals, not a patient-centric approach. So we said we have to change this, and we have to design these tools and these empowerment tools for the patient, and designing it in a patient-centric way. So what we did is, first we started, as we know, that prevention is a big cornerstone in healthcare, especially in managing a lot of diseases and reverse a lot of chronic diseases. So we started first in raising awareness among our society, among our population, and then we started developing technology tools from virtual clinics, from tools that enables people with disability, from bringing sign language interpreters to the sessions among the healthcare professional while giving the consultation to the patient. As we know that one of the challenges is a geographic barrier. We saw that in the pandemic, and actually the tools that we brought to the market helped tremendously in COVID, where a lot of doctors were connected to their patients and were able to provide for them their treatment plan and follow up on their conditions. So we started, as we know all, that innovation is a continuous evolving process. So we started reflecting and seeing how can we improve these tools, leveraging AI, leveraging different cutting edge technologies into that. So Alhamdulillah, this initiative is a nonprofit initiative that will continue, and we have a lot of support from around over than 2,000 healthcare professionals in that platform.
Excellent. Excellent. So let's transition to your time at the Vision Realization Office per Saudi Vision 2030, and we've heard about Saudi Vision 2030 before on the show. Specifically, in your case, the mission of this group, if I'm reading from the materials, to transform the health sector in a gradual, safe, and efficient manner, to ensure dynamic, technology-enabled, fostering both preventative and therapeutic health services. Clearly, falls within your set of capabilities. Talk a little bit about what the Vision Realization Office per Healthcare is all about, and a little bit about where digital health and these advanced technologies fall within the much grander picture of Saudi Vision 2030.
So as we know that the kingdom have embarked on a huge transformation, right, with ambitious goals, and to achieve that through innovation and through quality services. So these three pillars are thriving economy, an ambitious nation, and economic as well growth. So in healthcare, we focus on three main goals, which is how to facilitate healthcare access, how to improve the quality and the efficiency of healthcare services, and how to reduce any healthcare hazards or risks on the population. So we changed the paradigm where instead of focusing on the healthcare professionals and also the healthcare organization, we focused on the patient. And the model of care has a continuous different pathways, either a disease pathway and a technology pathway, where innovation is being dropped and articulated on each pathway. As we know, this technology, that it's not, first of all, it might work on certain patient and not other patients. It might work on certain groups, not other groups. So we have to be very careful in designing our pathway of delivering care. So with the rapid change, we had to come up with how can we also cope up with these rapid changes that are happening, that reshaping the healthcare delivery.
And one of the main I mean, there's many amazing examples here, but one that, I would love to spend a little time on, as I mentioned in the bio, is the SEHA virtual hospital. And I had to, at first I was just thinking, okay, this is just an app or something. But then when I really went into it, 130 hospitals around the kingdom, dozens of specialized services, something like 400,000 beneficiaries, telemedicine, and an amazing sort of telehealth ecosystem here. Much more than I thought when I first read, oh, it's a virtual hospital. Take us into the story here, because I think it's quite impressive. And then especially if you can then go into what the Innovation Enablement Center within the SEHA Virtual Hospital is all about.
So let me start, first of all, giving an introduction to what is SEHA Virtual Hospital. SEHA means health. SEHA in Arabic means health. So it's the largest virtual hospital around the world. Actually, today we're connected to 170 hospitals, not 130. We enable digital transformation. So our business model is we provide a B2B or B2C. So B2B means a healthcare professional to a healthcare professional. Sometimes, as we know, that in rural areas and peripheral areas, they find it difficult sometimes, especially when they get complicated cases, that they need help. Instead of referring the patient to these central cities, what we do is we connect with them and make sure that we deliver the healthcare delivery on spot to the patient and to the healthcare professional, where health knowledge have been exchanging between us and the other peripheral centers. We increased the trust as well, where patients have trusted the centers in the peripheral areas. And what we do is we provide also multidisciplinary committees, for example, in the cardiac and the oncology, where doctors have been selected based on their subspecialties to be part of the committees to discuss complicated cases across the kingdom. So, and why did we add Innovation Enablement Center? We started with COVID with 6 or around 8 specialties, and now we grow to 35 and having 55 subspecialties. The way that we introduce innovation, as we know, maybe innovation, it comes with its risk of thinking in a different way, risk of being a visionary, risk of trying a couple of things in a new way.
Yep.
In healthcare, traditionally, this is unaccepted. We're dealing with patients and their lives, so we have to be very careful. So what we did is, one of the things that we established is the regulatory sandbox, where we can de-risk any solution before having it bedside of the patient and making sure that these solutions drive value as well in the ecosystem. So we de-risk any harm, we test them, we make sure that we have a clinical governance, there is the minimum requirement, it's not harming the patient, and it's adding to the value of the ecosystem. Today, we have 16 government entities who are part of the sandbox, and they help us to enable innovation in the healthcare system. As you know, that maybe the term sandbox is used in the fintech, but they also say that fintech is the first to start the sandbox concept. But I say in healthcare and medicine, we started the concept of having a safe environment since the 1537, doing clinical trials and making sure that these medication or these procedures, before introduced into a real environment, have been tested and made sure that they are not causing, which is the first rule in healthcare, which is not causing any harm to the patient. So we've created that and have won multiple international and national awards of how are we leveraging new technologies to the different pathways and reshaping the way we're delivering care.
Excellent. And while we're on the topic of as your role of Chief Innovation and Sandbox regulatory officer, and it's important that you brought in that piece about regulation. I noticed there was, there's been a lot of press lately on different collaborations that you've been doing with small sort of healthcare companies. I think there was one from Korea recently I was reading about. how do you go about collaborating with external, if I was a digital health company and I wanted to come work with you, what's the whole process like today?
So driving innovation and fostering collaboration, it's at the cornerstone of what we do. Uh, Again, the formula for a success is collaboration. That's why we have 16 government and semi-government entity into our Committee of National Innovation and Regulatory Sandbox. What we do is we open up a portal on the Ministry of Health with the support of the leadership, and any healthcare solution or an innovation that can create or add value to the ecosystem get the support where we incubate and help to accelerate to be ready to the market. So what we do is, first of all, in the kingdom here, we try to align innovation with a quadruple aim. We check how can it improve the outcome, how can it reduce the cost, and how can it enhance the patient satisfaction and as well the healthcare professional satisfaction and experience. So we look into that, and we look into, is it a market fit? A lot of innovations are not market fit. We see a lot of intellectual properties certifications, and when you see have they translated into a real product or even an MVP, but you don't see that. Why? Because they don't have a market fit. So we study that, and we make sure with our partners that this is a market fit, and then we give them the full support. As you know, that these are solutions that might be introduced to the market for the first time. So we designed proof of concept and pilots under our supervision from subject matter expert to make sure, and we run some simulation labs and making sure that those solutions don't harm the patient, are making a lot of progress and ready to the market to make an impact and value on the healthcare system and on patients' outcome as well.
Excellent, excellent. One of the things I've really enjoyed, reading about, but also, and entertaining guests from Saudi on the show, are some of the mega projects that are going on in your neighborhood. One of them, obviously, is NEOM, and I've had the honor of having Mansour Hanif on the show, who's involved in drones and robotics and all sorts of interesting things happening there. I know there was just the huge Hevolution HealthSpan conference occurring in Saudi a couple of days ago. How do you, at the ministry and with the Innovation Sandbox model, how do you collaborate with some of these mega projects that are currently going on in the kingdom?
So we actively collaborate with our partners on these projects, where we share insight and work together to strengthen each other in order for the bigger picture, for the transformation, where the kingdom is becoming a global hub for innovation and progress and becoming a benchmark. Today, we're doing clinical trials for solutions that are the first time to be done. And we're seeing, as you mentioned, solutions are coming from all around the world. These are solutions that are incubated, not only from the kingdom, but across the globe. Solutions that have been coming from research center from China, from the United States, from Korea, all are welcome. Why are they applying? Is that because the answer is that we have the perfect setup, we have the support of the leadership, and we can accelerate and we can have these solutions be in the market in a safe manner and a fast pace. So a lot of success have been happening. For example, I mentioned the National Cardiac Services, where a committee are now leveraging augmented reality and also hologram and virtual reality. We prep them before they go to the surgery. We use live surgery streaming and augmented reality, where a surgeon from Riyadh is guiding a surgeon from Al-Baha through an augmented reality and passing the knowledge and increasing the confidence of that surgeon. Also increasing the use of technologies and knowing how to use them. I think that's a big gap that SEHA Virtual Hospital is raising awareness about these technologies and how to use it. as you know, that change is always difficult. How to have the buy-in of healthcare professionals and patients. You know that innovation is not only technology; it's in process and people as well. So sometimes you might have the perfect innovation, perfect technology, and the patient is not compliant with it, is not adapting with it. You need to learn. You need to see how can I really bring value, and how can I let the patient understand the value of these technologies.
Wonderful. And as you've taken us now to the beyond the cutting edge, when talking about the virtual and the augmented reality, we talk a lot about, what's coming next on the show. We've profiled concepts like digital twins. We've talked about this principle of aging in place and the smart home, and that as someone's aging, they may not want to go into assisted living, but think about the higher tech home as healthcare in the home, distributed clinical trials to access a much broader patient population, again, potentially from the home as opposed to medical center. What else gets you excited in terms of, when we start looking out to 2030 and beyond, the technologies that you want to put, what we call them cutting edge, bleeding edge, whatever you want to term them, that you'd like to get into the sandbox today to start playing around with, such that, you can hit the ground running in the next couple of years with them?
These technologies you mentioned is the reason why what got me into innovation. The continue of wanting to learn more about this technology and how can it make an impact, and how can it have a big impact on reshaping the healthcare delivery. I'm lucky to be working on these technologies and seeing precision medicine. We're seeing biotechnology. We're seeing virtual and augmented reality, robotic surgery. We worked on that as well. I'm lucky to see the advancement and the transformation, and how these technologies play a pivotal role on changing the point of care, and how are we utilizing these technologies to a better outcome. So it's always, every day is an exciting for us to be working here. The team and I always say that we are lucky to be in this field and witness where there is no possibility to like an endless possibility to the impact of this innovation can make. And it's just, it brings you joy to see real impact on the patient's life, especially if you see the quality of life. Now we see smart devices at home using IoT. We've been using wearables and Al-Hajj and Al-Umrah, and especially on cardiac cases with heart failure. And we saw how are we monitoring these patients and making sure that they're under our supervision, and if needed, they need to go to the hospital. We've seen the technologies that have been used on critical care. So it's just an exciting field, and I'm lucky to be in it.
Absolutely, absolutely. One last thing while we have you, I noticed, in addition to everything that you're involved in, per the Innovation Office, per the Sandbox, you do get out quite a bit to the conference circuit as well. What can we look forward to in terms of 2024, in terms of where we will see you, conferences, talks you're going to be giving, places that we can run into and meet you possibly? Anything else on the calendar that we should know about? Please have the floor.
We're working on a couple of big projects actually at the moment, nationally and cross-border internationally. We're working with the WHO on a couple of initiatives to make sure that some of the things that we've done here, we're becoming the benchmark, and it's our duty to share it with the rest of the world on our lesson learned and the insights and what kind of things that worked with us that might be helpful for other countries as well. And inshallah, it will be announced by early next year. This initiative, it's currently under the research and development. We'll be also having soon, on the 19th of December, a conference about AI with a collaboration with MIT Research Jameel
Nice.
Clinic. Also, we're having Sadaya and the Stanford Research Center as well, working in AI and healthcare on December 7. We're having a hackathon as well, where we raise the culture of innovation for the startups and for innovators and researchers. Maybe researchers, we didn't talked about this here in the kingdom, but researchers, as you know, that researchers always in the field of academia, they are the frontier of innovation. Yeah. But when they go out of the universities, they stop that. So how can we have the research translation? How can we let their outcome into reality? Have these products really come to life? This is some of the duties that we work in. We don't want researchers just their aim to publish at a high impact journal. No, we want your products to come to life, and we will help you with that. So we do these initiatives across the kingdom, where we raise the culture of innovation, where we have calling for abstracts and innovation, calling for competition. And this is not only on a local level, but also international level. We just finished the Innovator of the Year, where over than 70 countries have participated, over than 490 solutions have been applied across the world. And actually, we're seeing new solutions and new innovations come to life, which brings us joy as well.
Absolutely. Yeah, I'm glad you brought up that point about the academia and sort of that innovation that we all know occurs, but the ability to tap it and amplify it in this context. And again, I've enjoyed introducing and interviewing guests from the Saudi university academia system. And yeah, I'm excited for you. I'm going to look forward to continuing to follow you and your team and everything that's going on. Really a great story. For everybody, again, that's going to be listening to this particular episode of our show across the various podcast networks or watching it on our YouTube channel. Again, you've been listening to Dr. Mohammed Alhamali, Chairman of the National Innovation and Regulatory Sandbox Committee, Chief Innovation Officer and Regulatory Sandbox Head, SEHA Virtual Hospital Enablement Center, Ministry of Health, Saudi Arabia. Dr. Mohammed, I want to thank you again for taking the time out of your schedule to come talk to us and educate us to everything that's going on there in your group. Thank you for what you do. And as we like to say here on our show, thanks for helping to create a better tomorrow for many people via what you do. Really a great story.
Thank you so much. It was a pleasure being part of this episode. And once again, thanks for everybody.
Great having you.